Okay, I think we're going to go ahead and get started. Thank you all for joining us. This is the final seminar of the Western Center for Ag Health and Safety seminar series. So this is going to be a good one to end with because it's related to heat. And at least here in California, it is definitely heating up. Next slide, please. I'm going to go over a few housekeeping items before introducing our speaker. As a note, this seminar is being recorded and it will be available for viewing on YouTube tomorrow or later this week. All participants are muted. During the presentation, if you do have questions that you would like us to ask the speaker, please enter them into chat and we will keep track of them and post them at the end. As Yahaira mentioned early on, we do have Spanish interpretation for this presentation. So go ahead and please choose the channel you would like to be on. The globe-like icon at the bottom of your screen will allow you to select either English or Spanish. So especially if you'd like Spanish interpretation, please select that and you will be able to hear the entire presentation. Next slide. So I'm really pleased to be able to introduce Dr. June-Sept. Dr. Spector is a colleague from the University of Washington who is also with an ag center funded by NIOSH. And today she'll talk about heat illness, injuries, climate, and solutions for agricultural workers. So with that, I'm going to hand it over to you, Jim. Thank you.
Thanks so much, Heather. It is great to be here. Thank you so much for the invitation to speak. I will indeed be talking about heat-related illness and injury, climate, and practical solution for agricultural workers. I think the timing is such that it's on a lot of people's minds as we embark on heat season this summer. So what I'd like to do is divide the time we have together into 3 different sections. And so first I'm going to go over some of the recent research on heat-related illness and injuries. Then we'll talk a little bit about the context with the changing climate. And finally, we'll wrap up with some discussion about practical solutions and some of the work that's being done to evaluate practical solutions. So we know that heat can affect workers in a lot of different ways. And today's presentation will focus mostly on heat-related illness, traumatic injuries, and acute kidney injury. But I did want to talk about upfront some of the other effects that heat can have on workers. And so there is a list here, and I'm just going to talk about them briefly before we dive into those top few. We know that heat is implicated as a potential cause of chronic kidney disease of unknown etiology. And so what we've seen across the world, but particularly in Central America, Sri Lanka, India, Egypt, and some other countries, is that in young, otherwise healthy workers without risk factors for chronic kidney disease, such as diabetes, and originally described in sugarcane workers, we've seen pretty severe kidney disease, sometimes requiring dialysis or renal replacement therapy. And although all the factors are not fully understood, it's hypothesized that repeated heat exposure and dehydration may contribute to this. We also know that heat can affect the absorption and metabolism of chemicals. When we sweat to lose heat through evaporative heat loss and increase blood flow to the skin, this can actually increase absorption of chemicals through the skin. Also, with heavy physical work and a high respiratory rate for air pollutants through an inhalation mechanism, route of exposure, we can also see increased dose of exposure to air pollutants. We know that with increased core body temperature as well, that also contributes to changes in absorption, distribution, metabolism, and excretion of chemicals. I think on a lot of our minds as well is wildfire season. And as I'll share a little bit later briefly, we do see co-exposures to heat and high levels of fine particulate matter, PM2.5, during the summer season and overlapping with wildfire season as well. We know that heat can affect pregnancy and birth outcomes, including affecting birth weight and length, and that heat can cause additional stressors and mental health outcomes, which has been described, for example, among farmers, particularly during droughts. And we also know that heat has potential productivity and economic implications, as we need to slow down or take prepared to not work in very hot weather. So again, I'll focus on these heat-related illness, heat-related traumatic injuries, and acute kidney injury, but did want to just paint the picture that this is a much broader area with potential health effects. Before I move on more, though, I did want to spend a moment talking about terms that I'll be using. And so we hear these terms heat stress, heat strain, and heat-related illness. So when referring to heat stress, I'll be referring not only to environmental heat exposure, but also metabolic heat exposure that derives from heavy physical work. So it turns out that our muscles, our body is not 100% efficient. And in fact, is only about 20% efficient when it comes to heavy physical work. And so we do generate quite a bit of heat when we do heavy physical work. And it's the combination of these two that contribute to total heat stress. And when our bodies are overwhelmed, what we try to do is maintain a normal core body temperature around 37 degrees Celsius. And to do that again in humans, the main mechanism is evaporative heat loss through sweating. And what we do to try and facilitate that is dilate blood vessels near the skin, which involves our heart and our cardiovascular system, primarily through an increasing heart rate, increased cardiac output. And so there is that cardiovascular component as well. And when those systems, which are normal systems, are overwhelmed, we can get increases in core body temperature and heat stroke, which can be fatal. And that's a type of heat-related illness. And other heat-related illnesses as well, including heat exhaustion, heat syncope or fainting, heat rash, cramps, rhabdomyolysis or breakdown of muscles, which can actually also cause kidney injury. One distinction I do want to make is that in working populations, as well as athletes, we often talk about exertional heat stroke. And that again includes that component of metabolic heat exposure from heavy physical work. Whereas in the general population, we often hear the term classical heat stroke, referring to the young and elderly. And in those circumstances, it's primarily the environmental heat exposure plus physiological as well as behavioral barriers to cooling down. So for example, limited mobility and an ability to turn on an air conditioner or open a window, or perhaps not sensing thirst and being able to respond to that. So here we'll be talking about exertional heat stroke and heat-related illnesses among working populations. What are the industries at highest risk? If we look at fatality data, and these data at the top table are from the United States Bureau of Labor Statistics, Census of Fatal Occupational Injuries, CFOI, from 2000 to 2010, we see that agriculture, forestry, fishing, and hunting, the rate of heat fatalities is 35 times greater in that industry compared to all other industries combined, so very high risk. Also, we can look at data sources that include non-fatal heat-related illnesses, including workers' compensation claims databases. So there have been 2 recent studies or updates to heat-related illness surveillance that have been published in Washington and California. And in Washington, we see between 2006 and 2017 that agriculture, again, had the highest annual claims rate, as well as a very high July through September heat-related illness claims rate of 103 per 100,000 full-time equivalent workers. And then an Amy Heinzerling study from California looking at 2000 to 2017 workers' compensation claim data. Again, we see agriculture, forestry, and fishing with the highest heat-related illness claims rate, 39 per 100,000 workers. We always want to talk with workers, so I think it's important to step back. This was a survey study that we did in Washington in the summertime, a relatively small study in 2013, in which we surveyed about 100 workers using a computer-assisted survey instrument. And what our workers told us was that about 1/3 reported suffering from heat-related illness or heat strain symptoms during a hot day in the past week. About 1/5 reported being very concerned, and half at least had some concern about health being affected in hot weather. In addition to self-reported symptoms and concerns, there have been increasingly large studies looking at measuring core body temperature using ingestible core body temperature sensors, which you can swallow, and they wirelessly transmit your core body temperature to an external data logger. This first study at the top was a small study we did back in 2015 among 34 pear harvesters in Washington state. And here we measured for the environmental exposure wet bulb globe temperature, which is a combination of solar radiation, dry air temperature, and humidity. And we found the wet bulb globe temperature to be on average 28, And when we compared that to occupational safety and health guidelines from the American Conference of Governmental Industrial Hygienists, or ACGIH, during that shift, this was just for one shift, 44% of the workers exceeded, based on the clothing and activity levels that they had, what was recommended. And when we measured the core body temperature, we found that about half the workers were experiencing some level of heat strain during the shift. And that's been defined a little bit different in different studies, but often is considered above 38.5 degrees Celsius for acclimatized workers, or 38 degrees Celsius for unacclimatized workers. And it's been great to see that larger studies have now been done using this objective measure of core body temperature, including in California, including at UC Davis, and in Florida in collaboration with Emory. And so, for example, in California, a study of over 250 workers evaluated over one shift in the summertime, about 45% had a core body temperature over 38. And in Florida, a very different setting and an actually different set of tasks, so nursery, fernery, and crop workers, about half had core body temperatures over 38 degrees Celsius. So we're seeing now, in addition to symptoms, objective measurements of core body temperature. And so we know that we're experiencing heat strain among agricultural workers. So in addition to the heat-related illnesses that I mentioned and elevated core body temperatures, there's also been a lot of work, and really important work out of California, looking at acute kidney injury in the heat. And so this is one of Sally Moyse's study that I wanted to just share with you briefly here. In a sample of about 470 California agricultural workers over 2 summer harvest seasons, was measured pre and post shift kidney function, as you can see defined on this slide. And so the association between heat and acute kidney injury was evaluated. And in this study, about 15% of workers demonstrated some evidence of acute kidney injury after a shift of agricultural work. And we'll come back to this again a little bit later. So heat-related illness, heat strain, acute kidney injury. What about traumatic injuries? It's been interesting to see the research on this evolve over time. When we started looking at this, there weren't many studies looking at the relationship between heat and traumatic injuries. And now there have actually been over 12 peer-reviewed studies that have looked at this. And in fact, there's been enough study to be able to do a meta-analysis. And so the mechanism for the relationship between heat and traumatic injuries isn't fully understood, but there are hypotheses that, for example, when we get dehydrated, lightheaded, potentially that could increase the risk for falls, for example, from ladders when harvesting tree fruit. Also, sweat and grip is another factor that is sometimes considered in potential mechanisms. So I wanted to share one example of a study looking at the relationship between heat and traumatic injuries that we did in Washington State. And so often the study designs that are used actually for these studies are case crossover designs, which basically means that a worker on their day of injury, given the environmental conditions, is compared to themselves on a different day where they didn't have an injury, where we look at the environmental conditions on those control days. And that allows us to basically adjust for or take into account time invariant or factors that don't change over time. So that's what we did in this study. We compared workers on their day of injury for traumatic injuries to same day of the week on the same month days where they were not injured. And these injury cases that we got, about 12,000 were from the Washington State Fund Workers' Compensation System from 2000 to 2012. And these were traumatic injury claims east of the Cascade Mountains. And so that's what the red circle is. And that's where the most intensive agriculture occurs in Washington State. For the exposure data, we used gridded, so model meteorological data available at a 7 by 4.5 kilometer resolution. And we linked injury data by location and by date of injury and the control dates. And you can see, just for a frame of reference, that the May to September mean max daily air temperature was about 82 during the study period. And so what we found is shown here. On the y-axis are odds ratios, or essentially the risk, and those are the different black symbols, and the 95% confidence intervals of injury, adjusted for job tenure, which is time varying or varies over time. And you can see the red is for a maximum daily humidex, which is like a heat index, so a combination of dry air temperature and dew point, of 25 to 29 in the red compared to less than 25, in the green 30 to 33 compared to less than 25, and 34 or greater compared to less than 25. And you can see that for all the claims for the May through September claims, you can see higher point estimates, although more variability during cherry harvest, which is very intense early in the season, in June and July, and we have concerns about workers potentially not being fully acclimatized early in the season for apple harvest. And then the other thing that is important to consider is that many growers do change work hours in Washington state to start earlier and end earlier. And so we felt that potential injuries weren't necessarily being captured if they were later in the afternoon. So if we restrict to injury times just occurring within a specific time window, we see more of a dose-response relationship. But overall, what we saw, the takeaway, is an increased risk of Washington agriculture workers' compensation claims injuries in warmer conditions, particularly when the humidex was 30 to 33 compared to less than 25. Turning now a little bit to thinking about prevention, one of the ways in which we've started to think about prevention is, of course, to understand all the various factors that might be contributing to the high rates of heat-related illness deaths and non-fatal cases that I shared before. And so again, coming back to that survey study that I mentioned earlier, this study also asked about potential risk factors for heat-related illness. And a couple of factors came to the fore, including piece rate pay, so being paid by the amount harvested compared to hourly pay. And this actually had been described prior to some of the more recent research, piece rate pay as being associated with an increased risk of injury and observations of a financial incentive to work faster and harder, now being described with heat-related illness symptoms. Also, another observation is needing to walk farther to get to the toilet. And the idea here is staying very well hydrated, needing to walk to the toilet frequently, and potentially, particularly being paid by the piece, not wanting to take the time to do that, given the financial incentive to not do that. So 2 modifiable workplace factors. Now when we start looking again at the studies that have been larger that I mentioned before from California and Florida that have used core body temperature to measure outcomes rather than self-reported symptoms, we see some interesting things and confirm some of the findings that I shared already. So in our California study that I mentioned, again, work rate and Whipple globe temperature associated with elevated core body temperature. And this is very much consistent with that initial framing I mentioned to you before in terms of how we define heat stress, in terms of ambient environment and work initiated or metabolic heat generation. Similarly, in Florida agricultural workers, we see again, time performing moderate to vigorous physical activity, as well as the heat index. In their study, they also saw an increased risk of elevated core body temperature with field crop work compared to nursery and fernery work. A longer time working in agriculture was actually associated with a lower risk of elevated core body temperature and a higher body mass index. For acute kidney injury in California workers, again, it's that increased workload similar to for the elevated core body temperature. And as well, we see this finding again of piece rate work. So this comes out again when we look at the relationship between piece rate work and acute kidney injury of an increased risk there. So something to definitely think about. I think we do need to be very mindful, and we've heard from workers, the ability to make quite a bit of money during piece rate harvest is something to consider in terms of well-being and the amount of money that workers would like to make. However, I think there's something there that needs to be described, discussed, and further studied in terms of how to best balance protecting health and making sure that well-being is accounted for as well. Again, coming back to talking with workers, we have in the United States, not very many states with heat rules or health and safety rules that are designed to protect or intended to protect workers from adverse effects of heat. In California and Washington, there is a heat rule. There is actually one being proposed in Oregon as well. but there's no federal protection, no federal standard. And again, outdoor rules in California, Washington, there is an indoor rule for Minnesota. And so one of the things that we have been thinking about a lot is, yes, there may be requirements in those rules, but really what would be an effective implementation of those requirements? And as I'll allude to later, that could be variable depending on who we're working with, and definitely relies on hearing directly from farm workers about what is going to work well and what is not going to work. So in this study, this was a participatory focus group study of farm workers in Central Washington to learn a little bit more about heat-related illness knowledge, beliefs, and practices, and this was in 2012. And some of the themes that we heard, which have been described in other literature as well, is, for example, hydration, so water jugs being perceived as contaminated if located near restrooms. And we heard from women in particular that they had seen men urinating into these similar looking jugs near the restrooms, and so didn't really feel that that water could be trusted if it was in a similar container in that location. Also, there was concern about competing health concerns around overweight and obesity, and a belief that, oh, if I leave my layers on, it could be that I notice that my weight goes down because I've sweat a lot. So again, this competing health concern around weight that was shared with us as well. And so this is something that, as I'll talk about later when we talk about our education, we definitely want to acknowledge concerns and make sure that they're addressed without increasing the risk of heat-related illness. And then finally, a belief that cooling too quickly, there's health concerns that were shared. And this is, again, something that we have tried to acknowledge and integrate into our education, which I'll talk about a little bit later, given that rapid cooling is one way to prevent death from heat stroke. So I talked a little bit about heat-related illnesses and injuries. Now I'd like to turn a little bit to zoom out a bit and think about climate considerations. I think we've done a lot of work to characterize our existing weather and relationships with health effects, and in fact are already experiencing the effects of climate change. However, I think it is also important, as we work hard to do all the things we can to prevent heat-related illness in the present time, to think about a longer time scale and are there things we should be preparing to think about going forward. And so I'll share a little bit of information about some research that we've done, and really I think what this has highlighted to us are the key limitations of current methods and maybe some work that we could all think about how to move forward together, and challenges really with uncertainty in a lot of the things that we would need to really understand in order to make good plans for the future. So we know that heat waves are projected to increase in frequency and severity with climate change, and that absent mitigation, the Earth's average surface temperature is projected to increase between about 2.5 and 4.8 degrees Celsius before the end of the century. So how do we think about what to expect and how to prepare? It turns out it's quite challenging. And some of the reasons are, we have to know something about what's going to happen with crops with climate change, and there's a lot of research into that aspect. We have to know what might happen with migration and where folks are going to be living. We have to know something about what is the best way to estimate how much work is going to need to be done and where. We have to know a lot of different things that I think we don't fully have a great grasp on to be able to model for the future. So in this study, absent those methods, we made a lot of assumptions. So in this study, what we tried to do is characterize, using climate projections and population data across the United States, on average, what we would see going forward for the number of days above recommended thresholds for heat stress, again, based on those ACJH guidelines for working populations among agriculture, and then overlaying population data, as I mentioned, which is limited. And that is because population data used for this study come from the BLS Quarterly Census of Employment and Wages and does not fully capture our agricultural workforce. And so here, what you can see, making a lot of assumptions again, here we're assuming acclimatized agricultural workers working 90% of the time in an hour with metabolic rate of 300 watts, etc. With those assumptions in mind, present day on the top, in a 2 degrees Celsius warmer world and a 4 degrees Celsius warmer world, the number of days above the threshold limit value that's recommended for heat stress. And then in the right panels, when we overlay the population numbers for agricultural worker, the number of worker days. And so you can see areas of concern, including in the west and the south, as the temperature, the warming increases. But really what we wanted to try to get at with this is what would be the effect of the current recommendations, for example, in the ACGI HTLV for heat stress, in terms of cutting back those number of days above the threshold limit value? And is there something different we should be doing? And here the adaptation scenarios include reducing effort or time worked per hour from 90 to 50%, reducing pace from moderate to light, resting in the air conditioning instead of the shade, wearing single layer instead of double layer clothing, and then combinations of these. And so you can see the number of days above the TLV for the present in gray in the chart on the right, in a 2 degrees Celsius warmer world in orange, and a 4 degrees Celsius warmer world in red. And you can see that particularly with combinations of these that involve reducing effort and pace, we start to cut down the number of days above the threshold limit value, even in a 2 and 4 degrees Celsius warmer world. But I think there's big questions to ask here. First, is this really helpful for us given all the assumptions that I mentioned before? And can we do more work to understand the variability in those assumptions and the uncertainty? And secondly, reducing effort and reducing pace, we definitely want to protect working populations, but is that practical from the standpoint of what is needed to keep agriculture moving forward? And I don't think we have answers to those questions, and hopefully this presentation will stimulate additional thought and work in this area, because I think there's a lot to be done. In the setting of climate, I did just want to bring up one other aspect, which is of course what we mentioned before around wildfire smoke and exposure to heat. So this was a study that we did again in Washington State, where we overlaid exposure to heat, which was defined as a heat index greater than 85 degrees Fahrenheit, and exposure to PM 2.5 in the summertime, particularly thinking about wildfire smoke, defined as greater than 35 micrograms per meter cubed of hourly PM 2.5, and essentially looked at the hours above each and then hours of concurrent exposure by county in Washington State. And what you can see is the concurrent exposure, which is in blue, peaked during quarters where we would expect there to be heat and wildfire season. But also, as we overlay the population estimates in the gray bars, those are also the times where we have the most workers working in certain counties in agriculture. So this, I think, brings up a question, or what are practical solutions of potentially thinking about how we can combine our efforts and thinking about how to reduce exposure to both heat and PM 2.5. And I think that there aren't answers, and there hasn't been enough evaluation done of different practical solutions, nor talking enough with workers and getting ideas or the industry. But some things we can think about based on what we know are, again, we know that a lot of physical activity can increase internal heat generation, as well as increase our respiratory rate and potentially increase the dose of inhaled particles. So thinking again about work pace is something that could be relevant to both heat and PM 2.5 exposure, as well as such things as misting, which could bring down PM 2.5 potentially and also reduce heat exposure. But these have not been fully evaluated and tested. So again, I think there's more work to be done to think about combined exposures and how we might be able to address both. So now I'd like to move on to thinking about some practical solutions. And out in the internet and in the various literature, there's tons of great resources. And so I obviously can't talk about all of them. What I'd like to do though is share a little bit with you about a heat toolkit that's been developed through the Pacific Northwest Agricultural Safety and Health Center. And so the framework for developing a prevention toolkit really came from this idea that there's risk factors at multiple different levels for heat-related illness, including at the individual level. So for example, certain chronic diseases such as diabetes and high blood pressure. At the interpersonal level, we know that one of the effects of heat, particularly as we get to more severe heat illness or heat stroke, is actually to have limited ability to be able to concentrate and figure out your own symptoms. So having a buddy or a coworker available is incredibly important. So interpersonal factors. We talked already about some modifiable factors for growers at the workplace. And then as well, thinking really from a total worker health perspective about the fact that heat doesn't know the difference between where the work site is and home. So we have a heat exposure that cuts across the workplace as well as at home. And there's opportunities in housing and in the community for cooling. And so understanding how to optimize those, I think, is another aspect in this multi-level set of factors. And so this is known as a social ecological model. And so the framing for our work really was within this multi-level setting. And as I'll describe, we worked with advisories to come up with a set of resources, including a training or education and an app that address multiple factors at these different levels. So our approach for developing prevention has really been stakeholder engaged and iterative. We work with an advisory board to help direct what we're doing. That includes our Farm Bureau, growers, local irrigation district, our colleagues at Washington State University, agricultural weather station network, and a community health center. And we also work with an expert working group of tree fruit and grape workers and management, which are a large part of sub-industry within agriculture in Washington State. And others are consulted as well, including our Department of Labor and Industries and our University Center for Teaching and Learning, as well as, again, our Agricultural Safety and Health Center. And so with this advisory, one piece of the toolkit is education. And the education that we've aimed to develop really is participatory, train the trainer. So intended to be used by a variety of different folks, including supervisors, health and safety professionals, promotoras, and others. It's designed to address both work and non-work factors. So again, bringing back the housing, as well as some of the things we've learned from talking to workers about perceptions and beliefs, and what to do if workplace resources are not available. And this is something that has come across strongly to us from talking with workers as something to include in our education. And again, designed to be modular and scalable for use in different settings. So it can be used in the field, can be used in a classroom setting. And the approaches that we tried to integrate include a relational approach. We know that increasing inclusion and shared learning and team building, we know from the literature that increases the perception of supervisor support and job satisfaction and can potentially decrease the risk of injuries. We also know that an engaged approach, which we tried to integrate as well, or engagement and active participation, can increase knowledge acquisition, behavior change. And again, this is from the injury literature and decrease injury risk. So with these two together with the socially ecological model, we developed education. And I'll walk you through a little bit just to give you a sense for what is available. So again, I'm going to be focusing mostly on giving you a little preview of our heat education. But I did want to mention the second component that we have and we're continuing to test this summer is a voluntary heat awareness decision support mobile application for supervisors that partners with Washington State University's agriculture-specific weather station network that is very well trusted and used for crop decision support, upon which we've been able to overlay this health component as well. And so there is already an existing app out there from OSHA and NIOSH, a heat app. That app is based on the heat index in your location, and it gives really helpful tips and tools for preventing heat illness among workers. This app is a little bit different in that it gives a bit more advanced notice of heat waves, so up to a week, because we heard from growers a desire to have more forecasting, more advanced forecasting for work site planning. It does make tailored agricultural specific practical recommendations for prevention, and it does provide weather metrics of interest to growers. And as I mentioned, the heat index, which is a combination of dry air temperature and relative humidity, is used in the OSHA NIOSH app. We actually did some extensive evaluation comparing heat index, wet bulb globe temperature, and estimated wet bulb globe temperature from weather stations, and determined in our study area that heat index actually performs pretty well. So our app is also heat index based, and it basically uses published methods to crosswalk back to wet bulb globe temperature risk categories from the ACGA HTLV. And I can talk more about that in the question and answer period if there's questions, but for now I'm going to focus on the heat education piece. So the topics covered in this English-Spanish material, which is available online at the link on the slides, includes all of the topics that are required in the Washington heat rule. So types of heat illness and treatments, risk factors, clothing for work in hot weather, personal protective equipment, keeping cool at home and the community, and staying hydrated at work. And so just to give you a little bit of an example, there are these different elements: the facilitator's guide, checklists, worksite posters, case scenarios, and role plays. And in terms of the facilitator's guide, this is just an example for one of the topics on symptoms and treatments for heat illness. And this is again available in Spanish as well, where we start with group discussion questions. And here for this topic, there's examples of responses, including specifically addressing that concern I mentioned earlier, again, integrating what we've heard from workers about how to sort of discuss with workers about this concern of potentially cooling down too quickly. And so there's language for how to discuss that and notes for the facilitator around how to address cultural beliefs. And then there's a worksite poster, and I'll show you examples of that in a moment, that has content on it that can be reviewed, including in the field. There is an activity, so that engaged element, some take-home messages, and notes for the facilitator. So as I mentioned, each topic has a worksite poster. So I wanted to just share some of those with you. Again, these are available in Spanish as well. So here, the goal for all these posters is to have a simple message, a clear message at the top of the poster, and then really be illustration-based. And so this one focuses on symptoms and treatments for heat illness, with the message that symptoms of heat illness can be mild or severe, and that knowing symptoms and treatments is important to prevent serious heat illness and death. And so the types and symptoms are on the left, and the treatments are on the right. Here there is information about risk factors at different categories, so personal, workplace, and weather, and a message at the top. Here we have clothing for work in hot weather, and the message is wear light-colored, lightweight clothing and a hat when working in the heat. And here we really iteratively worked with workers and growers. There were competing concerns about UV exposure, about exposure to dusts, getting scratched, and other things that were integrated into thinking about the visualizations and the pictures that were included here. So what to wear on the left, what not to wear on the right. Staying hydrated at work, and here again, really tailored to what we learned about the various different types of containers available, including these paper cones and equivalent volumes to bottles that were being used and what is recommended, and that is a ½ liter per half hour on average, and how that corresponds to urine color. And then finally, again, keeping cool in the home and the community. So thinking about inside the home, opening windows if it's safe when it's cool in the morning and evening, closing shades in the middle of the day to prevent solar radiation heat from that, cooking outside to the extent possible, fans and shade outside, as well as places in the community to cool off, including lakes, community centers, etc. We did, of course, want to include information that was requested by workers, and that included this hierarchy of who to contact if there's still concerns about what's happening in the workplace that workers may be comfortable contacting, and then information about how to document and record what's happening. So I won't be talking about the other elements, but there are checklists, case scenarios, so cases that have occurred among farm workers in other parts of the country over time that can be used for teaching, as well as role plays. And so each topic takes about 15 minutes, but the role plays do add additional time. So we put them as an add-on if desired at the end of the manual. And so I think one question that we have is, okay, well, how well does this education help workers in terms of knowledge and also symptoms and heat strain over the course of a summer season? So we did a study to look at this. This was a randomized study where we collected data in the summer of 2019, and we were also going to collect data in the summer of 2020, but because of the pandemic, we only have 2019 data, in which we enrolled 4 companies and 6 crews. We recruited 83 workers who underwent a baseline survey and a knowledge assessment, which consisted of 12 knowledge questions related to heat-related illness. And then those crews were randomized to a heat intervention group that received the heat education, and supervisors received the app, and a comparison group. And immediately after the education, there was an immediate post-education knowledge assessment. And then during the course of the summer season, there was a heat symptoms assessment, a monthly heat strain assessment, so estimating core body temperature, and then a post-season knowledge assessment in both groups. And I will say we're still analyzing the symptoms and heat strain data, but I'll share some preliminary data on the knowledge assessment with you. The comparison group was offered training on a different topic, but I will just mention that in Washington State, there is a heat rule. And so all workers should be obtaining training on heat-related illness. So in theory, the comparison group got that too, just not our training. But they were offered heat training at the end of data collection as well from our research team. And these are some preliminary results. So here in the figure on the right, we have knowledge score on the right axis, and then pre and post-season scores in the comparison group, which is in red, and the intervention group in green. And we found a difference between pre and post-season scores that was greater in the heat training group and the intervention group than the comparison group, and this was statistically significant. And we found that improvement in pre-post scores was driven mostly by improvement in knowledge about heat-related illness, risk factors, and treatment. And so the data on heat strain or estimated core body temperature and symptoms is forthcoming, and hopefully can share that with you at the next opportunity. I did also want to mention briefly that there's been some great work done by Roxana Chicas at Emory among Florida agricultural workers, looking at personal cooling intervention studies, including bandanas, as shown here on the right, and cooling vests. And the cooling vests, they do have cooling elements that need to be changed every few hours. And in this pilot study, so this is a very small study, as you can see from the statistics here, they evaluated control bandana vest in a combination. And interestingly, the bandana was most promising in reducing the amount of time above a core body temperature, again, measured with those core body temperature ingestible pills. So in reducing the amount of time above a core body temperature of 38, as well as the percentage of participants who had a core body temperature greater than 38 degrees Celsius. And there was some discussion about perhaps the difficulty practically of using the cooling vests in a field setting. So more to come. This is a small study, and I think the investigators are planning to do a larger study. And so hopefully we'll know more about how these interventions might potentially help keep folks cool. So I wanted to end just again recapping some of the solutions for both employers and supervisors as well as workers that we often share, and definitely would love to hear more in the Q&A session about your experiences and other things we might consider here. These are based in part on the research that I shared. So again, scheduling time to allow for acclimatization. So it takes about 2 weeks to fully acclimatize, and there's guidance for how to gradually increase the time working in the heat that's shown in the figure on the bottom right. Rest and water breaks in the shade, working during cooler hours of the day, however, being careful about other hazards that might be created by making that shift, including it being very dark if you start early and making sure there's enough light to avoid injuries. Locating adequate amounts of drinking water away from restrooms and near workers in closed, clear, and labeled containers. Payment schemes that incentivize increased exertion may be dangerous on hot days. So that's another area I think where more work can be done. And again, although it's required in Washington and California, really thinking about states in which there isn't a heat rule as well in terms of having a written outdoor heat program to evaluate, control, and manage heat stress, including emergency response procedures. Providing training in a language and format that workers understand, and thinking about our results so far from our evaluation of our heat toolkit. Knowing the weather forecast and being able to plan, providing restrooms near work sites, and potentially providing cooling devices, though I think that we still have a lot more to learn about which cooling devices are going to work best. And then for workers, not waiting until you're thirsty. If you're thirsty, you're already dehydrated. Wearing loose-fitting, lightweight, light-colored clothing, knowing personal risk factors, again, coming back to that buddy system element that we talked about before, and that multi-level framework, watching out for coworkers, general health, eating healthy foods and getting enough sleep. And then this question again about the best cooling devices, more research is on its way. And this again, just to reiterate, making sure that workers do know what to do if there are unsafe conditions at work in terms of who to talk to and how to document those. So I did want to share that this summer we'll be working with national partners to bring new heat tools and resources to growers, trainers, and workers. And so if you're interested in participating, you can contact Denise at the Pacific Northwest Agricultural Safety and Health Center. Her email is listed here, and I think these slides will be available to you. And she can share our social media kit with you. Also just want to highlight some additional resources at the link at the bottom, again, that you will be able to find on the slides. And finally, there are some resources available through our Agricultural Safety and Health Center around heat and COVID, including these resources on cloth masks and heat, as this question comes up a lot around respirators and masks and heat. And so I think I will end there and definitely want to acknowledge the vast array of folks that have been involved in the work that I shared. And I'm happy to take questions.
Wonderful. Thank you so much, June. It was a great presentation, and I know that we often go and look at all of the great resources and research findings coming out of UW and PNASH on heat illness. We have received several questions, and so everyone in the audience, please continue to submit your questions, and I will pose them to Dr. Spector. Okay. Let's see, a question related to face masks, and you actually alluded to the fact that there's often questions around face masks. And so one that came in, would face masks to minimize PM exposure and inhalation be beneficial to reduce heat-related illness?
That is a great question. I'm actually going to go ahead and share my slides again for a moment because I have a slide on this. This question comes up a lot, and we have to make sure that it was very helpful in the question asking specifically about, for example, wildfire smoke exposure, PM 2.5. So the type of respirator, we actually need a respirator for that. A cloth mask is not going to work. So it could be an N95 respirator. There are other particulate respirators, for example, half-face respirators. And yes, so those can for sure be effective if they're fit properly against PM 2.5 or air pollution related to wildfire smoke. I think the question that comes up a lot is, do those cause heat illness? So do those respirators cause us to develop heat illness? And it's interesting because in looking at the literature on this, for sure, thermal comfort is affected by the temperature of your face. So there's studies to suggest that if the skin temperature of your face is more than about 34.5 degrees Celsius, you feel pretty uncomfortable. However, there have also been studies that have been done in laboratory settings. So you see this picture on the right of the person wearing this clothing ensemble that has coveralls. They tested this ensemble with and without a respirator under exercise conditions. And it's a small study, but they didn't find a significant difference in the environment at which someone would actually start to have an increased core body temperature. And so in this study, they didn't find significant differences with and without that big respirator in terms of the core body temperature or the physiological strain index. So we think that the respirators definitely can, we know they're protective against PM 2.5 or wildfire smoke exposures. We don't think that they will cause heat-related illness or heat stroke. However, they might be quite uncomfortable. And this is different for these respirators than the cloth masks that were recommended earlier in the pandemic, which again are not going to protect against PM 2.5.
That's really interesting and something that I think we will want to follow up on in terms of education and outreach, because we do hear people complain about the comfort level of wearing a respirator and heat. And certainly we hope for not a bad wildfire season, but I anticipate we will be faced with the combined effect of wildfire smoke exposure and heat for farm workers. So that's good information for us. Thank you. Okay, another question related to training and heat illness risk. Do you know of other studies or studies showing a link between training provided and health outcomes? So does education work?
That is a really good question. And, when we started and proposed our evaluation of our educational materials, And I guess I shouldn't say that it's training exactly, because it really, ours is more education, not specifically training and implementation and evaluation of following, for example, emergency procedures for heat. So I guess I would characterize it more as education, but we were not able to find studies that have a controlled or comparison designed to evaluate the training. There are not very many studies like that. They are costly to do and involve a lot of participants often. But we felt it was really important to understand, does this work? Because I think there's a lot out there. And in particular, there's this question that lingers about, there's rules, in California and Washington, and they all require some level of training. But we want to know how to implement that in such a way that it's actually effective. So I guess in answer to your question, I'm not aware of other studies that have actually looked using a comparison design at different heat illness trainings, and it's possible I missed some to try and see if they work. And I think so far we're encouraged that at least for the time period that we evaluated ours over a summer season, we saw sustained improvement in knowledge. But again, we haven't then checked the next season, although the training is typically annual, or should be, is required to be. And I think we could do more, I think, to evaluate in different interventions to see really if they're working, because they do take quite a bit of effort and resources to implement, and we want to make sure that we're using those in an efficient way, in a way that works.
Great, thank you. Okay, a question about implementing acclimatization procedures, so that 2-week period that's recommended to get used to the heat. If workers are told they cannot make a full day's wage for up to the first 2 weeks, they may leave because they're not supposed to work as much or as hard. They might leave and go and work somewhere else because of the labor shortage issues and the way that the labor force can sometimes work. So do you have recommendations on a practical level about how employers should be handling that?
That's a really good question, and I think an area where it would be great to work with growers and workers to come up with a practical solution here. And it is really challenging. I think, again, is it practical? Ideally, we would be able to include payment for that time of acclimatization period where one can't work for the whole day within our system, but that is not the way things are currently set up. So I really appreciate the question in terms of practically how do we deal with this. If there are possibilities to do tasks not in the heat, and then have that, couple-hour period initially of working in the heat. So doing a combination of different things where one portion of it would be in the heat to allow for acclimatization, and that portion grows over the time period would be ideal. But again, that only works if it's practical. So I think this is one of those areas where we really need to come together and learn from each other about, are there good ideas that really actually could work in terms of how to fit that acclimatization piece in. I will say that some of the aspects of physiological acclimatization do kick in actually after the first couple of days. So you get gradually more acclimatized in different aspects of physiology over the time period. So there may be a way also to think about what window there is really most critical to consider when we also balance that with practically what makes sense.
Great, thank you. I was doing a little bit of background research for the next question as I was listening. So this one is about indoor heat illness, and I'm not sure if you've looked at that too much, but the person asking the question notes that greenhouses can be particularly dangerous because of the sun and humidity. And so they're asking about regulations related to indoor workspaces. Are they counted as such, or are they subject to outdoor regulations? And I think this potentially varies by state, and I'll note that you're working up in Washington.
Right, that is a great question, because of course with heat and cold, these things can occur in indoor environments as well, or even with heat and point sources of heat in an indoor or outdoor environment. In Washington state, and as far as I understand California, the heat rules apply to outdoor spaces. However, it might be worth looking at the Minnesota rule, because in Minnesota, they actually do have a rule that pertains to indoor environments. So one could take a look there and sort of see that as an example of how that was handled in policy in Minnesota. I think though the same principles in terms of the environmental controls do apply. And in fact, you potentially have more control over that in an indoor environment than an ambient outdoor environment. And so there we think again about, there may not be solar radiation potentially, or there could be in a greenhouse setting, but in a setting where there isn't windows, for example, you may or may not have that solar radiation piece, but certainly the ambient temperature as well as the humidity, those are all things that are going to contribute to your overall heat stress. So ways to think about mitigating those or being able to recover from those in a different area, I think are things to consider. But I would suggest, taking a look at the Minnesota's rule, which pertains to indoor environments, might be a good place to start. And maybe it's something that we should think about. As I mentioned, Oregon is initiating rulemaking for heat exposure. And that is an issue that is being actively discussed among stakeholders in terms of both the indoor and the outdoor environment. So a really good question.
Thank you. And I know that California has been in that type of discussion for some time. And I pinged David Hornung to see if maybe he can voice whether or not that has gone into effect in California yet. I don't believe it has, but I could be wrong. But that's something that is likely to be added to, oh, here he comes. Maybe. There you go, David, you have the floor.
Hi, so the indoor heat standard is still going through its regulatory impact assessment. So they're trying to figure out the finances of it. There is a draft of that up though from April 29th of, I think maybe last year or the year before, that's on our website. We think that that's going to be very similar to what the permanent standard looks like. Of course, it has to go through all the rulemaking.
Thank you so much, David, coming to us from Cal OSHA and one of our external advisory board members. And I have the link to that. I believe this is going to give you that language from, I think it was 2019. So thank you all. Hopefully California will follow Minnesota in the not too distant future. We are right at the end. And I think that I'm going to call questions there and note that the presentation will be available on YouTube in the next day or two in both English and Spanish. And Dr. Spector, we're just so pleased to have you close out the season for us. Unfortunately, it's likely to be a hot one. And so good safety tips from UW. And I know that we also here at UC Davis and the Western Center have some new heat illness related educational materials that we encourage you to take a look at and request. We're sending them out as probably as we speak. Okay, so thank you all very much and stay connected to our newsletter. We will be beginning our seminar series again, I believe in October of 2021. So take care, everybody.